Have you ever wondered what it actually feels like to live with a mental health condition? And I mean really feel it, not just reading a textbook definition of anxiety or depression or bipolar disorder. I'm talking about the actual day-to-day, moment-to-moment inner reality. Well, welcome to This Explainer. Today we're going to move way past the clinical jargon. We want to explore how these conditions truly affect the way a person thinks, feels, and functions every single day.
Okay, let's dive into this. What does it actually feel like? That question right there, that is our guiding light for this explainer. Look, we aren't here to label people. We definitely aren't here to reduce anyone to a medical diagnosis. We're just here to foster a genuine, completely non-judgmental understanding of what these invisible struggles actually feel like from the inside out.
So, here is our roadmap. We'll start with the inner reality, then explore anxiety and depression. From there, we'll navigate bipolar, OCD, and PTSD, followed by ADHD and eating disorders. Finally, we'll wrap up with why understanding matters. Now, one super quick but absolutely crucial note before we jump in. Everything we cover in this explainer is strictly for educational purposes. It is absolutely not a substitute for professional diagnosis or treatment. If anything we talk about today sounds deeply familiar to your own life, talking to a doctor or a therapist is always the right next step.
Right, so part one, the inner reality, beyond the labels. Moving into part two, anxiety and depression, the baseline shifts. So these are by far the most common conditions, and what they fundamentally do is shift a person's emotional baseline, making the whole world feel vastly different than it does to someone without them. Let's start with anxiety. At its core, anxiety is essentially the brain's alarm system totally misfiring. Imagine the fire alarm in your house going off, right? But there's no smoke and there's no fire. Or imagine it completely overreacting to a tiny danger, making it feel like a literal life or death threat. That is the reality of anxiety. It's a physiological response to a perceived threat that just doesn't match the environment.
Now, anxiety isn't just a one-size-fits-all experience. On one side, we've got generalized anxiety disorder. Think of this as a constant, low-grade worry about absolutely everything: work, health, relationships, money, you name it. It is exhausting, because the brain literally never gets to switch off. On the other hand, social anxiety is an entirely different beast. It's an intense, almost paralyzing fear of being judged or embarrassed. Imagine absolutely dreading a simple phone call, or having to rehearse a basic, everyday sentence in your head for 10 whole minutes before you can finally get it out.
These different forms of anxiety, and that includes panic disorder, where sudden waves of intense fear bring on a racing heart and shortness of breath, they deeply impact everyday life. The ultimate result? Anxiety shrinks a person's world. People turn down great opportunities, they avoid parties or gatherings, they struggle to focus at work because their mind is completely hijacked, stuck in this relentless, exhausting loop of what if, what if, what if.
Then we have depression, or major depressive disorder. And I just want to slow down here for a second. Depression is not just feeling sad. It's this persistent low mood that completely drains your energy, your motivation, and your interest in the things you used to really love. For someone living with depression, simply getting out of bed in the morning doesn't just feel kinda hard. It can quite literally feel like trying to climb a mountain.
You know what makes depression so incredibly tricky to understand? It's invisibility. People often describe it more like a heavy numbness rather than, just crying all the time. Simple tasks like taking a shower or making a piece of toast feel completely disproportionately exhausting. Sleep and appetite can swing wildly to extremes. But perhaps the most jarring reality is that someone can smile, go to work, and function outwardly, all while feeling completely hollow inside. And because this chronic low energy takes a massive physical toll, this invisible reality deeply affects relationships, jobs, and overall physical health. Section 3. Bipolar, OCD, and PTSD. Cycles and control.
This next group of conditions is characterized by intense, unpredictable cycles and complex struggles with control. Bipolar disorder, for example, is a condition of extreme shifts. Now, what's really interesting about this slide is how it contrasts those extremes. On one side, during a manic or hypomanic episode, a person might feel incredibly euphoric, speak super fast, take massive risks, and feel like they hardly need any sleep at all. But then, the pendulum swings. The mood drops into a depressive episode, bringing that exact same profound hopelessness and low energy we were just talking about. The true day-to-day challenge of bipolar disorder is this very unpredictability. It can upend plans, finances, and relationships in the absolute blink of an eye.
Next up is OCD, or obsessive-compulsive disorder. Honestly, this is probably one of the most misunderstood conditions out there. We really need to completely ditch the idea that OCD is just about being neat or super organized. It's not. It is fundamentally a distressing, exhausting cycle of intrusive, unwanted thoughts, followed by actions meant to find some temporary relief from the panic those thoughts cause.
Let's break down how this cycle actually plays out. It starts with an obsession. This is an intrusive, terrifying thought like an intense fear of contamination or a sudden fear that you've accidentally harmed someone. This triggers step 2, the compulsion. That's a repetitive behavior or mental ritual performed just to relieve that terrible distress. Think washing your hands until they bleed or checking a lock 50 times. Finally, step 3 is relief. But, and this is key, it is only ever temporary. This cycle can completely consume hours of a person's day, severely messing with their ability to function.
Now, for those living with PTSD or post-traumatic stress disorder, the reality is that the alarm system we talked about earlier, it has been permanently rewired by a traumatic event. When that happens, the entire world fundamentally changes. Ordinary, everyday situations suddenly feel deeply, deeply unsafe.
So, the daily reality of PTSD means living with hypervigilance. It's this constant, exhausting sense of always being on alert for danger. A person might experience intense flashbacks or nightmares. And the tricky thing is, the triggers can be deceptively simple. A loud noise, a specific smell, or just walking into a certain type of room can cause a sudden, terrifying flood of distress tied directly back to the original trauma. It disrupts their sleep, their relationships, and their basic sense of security in the world.
Section 4. ADHD and eating disorders, focus and inner distress.
Over here, we're looking at conditions that deeply impact mental regulation, focus, and a very complex relationship with control and the physical body. Let's clear up a massive misconception right off the bat. ADHD, or Attention Deficit/Hyperactivity Disorder, is not just a childhood issue, and it doesn't mean someone simply can't focus. It's actually a difference in how the brain regulates focus and impulse control. For someone with ADHD, their attention acts like a superpowered magnet, drawn powerfully to whatever is most stimulating in that exact moment. Day to day, especially for adults living with ADHD, this translates into some real struggles. Sustaining focus on unstimulating tasks becomes incredibly difficult. We're talking missed deadlines, losing large chunks of time, struggling to organize basic tasks, or making sudden, impulsive decisions. It is so important to understand that this is a matter of brain regulation. It is absolutely not a lack of effort, intelligence, or willpower.
When it comes to eating disorders, like anorexia, bulimia, and binge eating disorder, we're dealing with incredibly serious conditions that carry severe physical and psychological risks. Now, because this is such a sensitive topic, we aren't going to list specific symptoms or behaviors here today. But the vital thing you need to grasp is that these conditions are rarely just about food. Underneath it all, they are deeply connected to a complex relationship with control, body image, and underlying emotional distress.
And finally, Section 5. Why understanding matters. Breaking the stigma. We've gone through a lot of clinical realities today, but how does all of this connect back to you and the people you interact with every single day? Well, the absolutely crucial point is this. Mental health conditions are not character flaws. They aren't weaknesses, and they're absolutely not things that people can just snap out of if they try hard enough. They are real, complex, and overwhelmingly invisible struggles that dictate how a person thinks, feels, and navigates their entire day. Understanding this is how we build a better environment for everyone. When we truly understand what these conditions feel like, we naturally decrease the stigma surrounding them. Empathy replaces judgment. And you know what happens when that stigma drops? People are far more likely to stop suffering in silence and actually reach out to get the professional help they desperately need and deserve.
And on that note, if you're watching this and you are struggling right now, please hear this. Talk to a mental health professional. If you are ever in a crisis, reach out to a crisis line in your area. There are people out there who understand exactly how heavy this is, and you do not have to go through it alone. Help is out there.
We've explored the inner reality of some pretty profound invisible struggles today. So, I want to leave you with this final thought. How might this new understanding change the way you treat the people around you today? Maybe it's the coworker who seems a bit distracted, the friend who canceled plans again, or the family member who seems inexplicably tired. Empathy starts with understanding. Thank you so much for joining me for this explainer, and I really hope it sparks some curiosity in you to keep learning. Take care.